Next, we have 3 tests that are going to help you assess whether or not a patient may have appendicitis. The first of those is referred to as Rovsing sign. So what we're going to do to elicit Rovsing sign is we're using kind of a dipping motion with our hands like this, and we're applying firm pressure in the lower left quadrant of our patient. Angela, do you feel any pain there? So that's a negative Rovsing sign test. In the case of a positive test, the patient would feel pain in their right lower quadrant. Tensing that fascia will cause an inflamed appendix to be rubbed up against by the fascia, and because of the inflamed appendix, you may have actually some fascial irritation as well. So pressing down on that left side will recreate that pain. The second test that we're going to perform to test for appendicitis is referred to as Psoas sign. So we are going to place our hand on the patient's right knee. And Angela, if you could just lift your leg against my resistance. Any pain or discomfort there? Okay, you can relax. So that's a negative sign again. For a positive sign, again, we'd be experiencing, a patient would be experiencing pain in that right lower quadrant. By flexing the leg, we're tensing the psoas muscle, and in the case of an inflamed appendix, that tension is going to further irritate the appendix and cause pain in the patient. The final test is going to require the patient to flip over onto their left side, and this is called the Obturator sign. So, Angela, I'm going to borrow your leg briefly here. Just go ahead and relax. We're going to bring them into flexion at the hip, and then internal rotation of the thigh. Do you feel any pain or discomfort? Okay. Again, that's a negative test. If we did get a positive test, the patient would again be feeling that pain and discomfort in the right lower quadrant. This time we're tensing the internal obturator muscle, and that's another muscle that lies close enough to the appendix that if the appendix is inflamed, you're going to feel that pain response there in the right lower quadrant.